Thank you, sir.
Yes.
Thank you.
Everyone, the topic of my free paper presentation is the AI revolution in dry eye diagnostics. I do not have any financial disclosure in this presentation. Artificial intelligence, as we all know, has taken its grasp over the healthcare system, and ophthalmology being one of the most dynamic streams is largely influenced by the AI. The AI-based imaging software has helped in the diagnosis of the dry eye diseases easier. Currently, many studies have come forward with the promising results of the AI-based algorithm in diagnosis of the dry eye diseases. The subset of dry eye in AI in the diagnosis of dry eye is a machine learning which interprets the NIVT and interferometry and deep learning curves for the mammography. The dry eye market is flooded with the many devices like the corneal topography, wavefront aberrometry, inflammadry, to name a few, as it is not feasible for every ophthalmologist to purchase all these devices. That's where the multi-imaging integrated device comes into play. The purpose of our study is to assess the effectiveness of the novel dry eye analyzer created by AI in diagnosing patients with the ocular surface disorder. It was a prospective study done on 190 subjects. First, the patients were sent for the ocular surface disease index questionnaire, then followed by the dry eye analyzer, and then followed by the traditional Shermer and ocular staining. The ability to distinguish the aqueous deficiency or evaporative type is pertinent in deciding the treatment modality. So the dry eye analyzer consists of NIVT, tear meniscus height, infrared mammography, and lipid layer interferometry. NIVT uses the Placido's disc projection and C for the image distortion. First, it gives a breakup time, average rupture time, and then generates a heat map. And tear meniscus height is measured by using an inbuilt ruler in line with the pupillary center. The above two images are showing the normal tear meniscus height, and the lower two images are showing the abnormal tear meniscus height of less than 0.2 millimeter. Infrared mammography uses an autofluorescence of the healthy mabum when an infrared ray falls on it. The first image is the image obtained coupled with the AI coupled camera device, and then AI image is superimposed upon it to see the gland loss. The first image that we can see here is showing the normal meibomian gland, and the second image is showing the grade 2 MZD with the 40% gland loss, and the third image is showing the grade 3 MZD. Lipid layer interferometry is based on the principle that when an adequate bright light falls on an adequate light falls on a lipid layer, there is generation of the interferometric fringes. Thicker layers are denoted by the colorful fringes, and the thinner layer with the colorless fringes. So coming to the result of our study, we found that in Shermer test, 12% of the patient had severe dry eye, and 35% of the patient had MZD2 and MZD grade 3 abnormality, and lipid layer abnormality was found in 42% of the patient. Out of all the patients presented with the signs and symptoms of the ocular surface disorder, we found that 72% of the patient had dry eye. While we plot the abnormalities in a graph, this is how the graph looks like. So what we already know of the multi-modality device is that it is automated nature, non-invasive, and less time consuming. But what our study adds is that meibomian gland disease and abnormal lipid layer thickness contributes more than 50% of the cases, and there were certain cases missed by our traditional test. And limitation of our study lies in the fact that monitoring of the patients over a course of time was not done. So what are the translational potential of our study? It is an image-based targeted therapy. This is how the report of a dry eye analyzer looks like. Here we can see the color-coded report. It helps in raising the patient's awareness and compliance to treatment. Using this analyzer, precise monitoring of the response to treatment can be done. Thank you so much for your kind listening. My take-home information is, sir, in a busy OPDs, we can use the AI for easier diagnosis and less time consuming.
Is there any disadvantage?
Disadvantage being, sir, AI cannot detect human emotions, so it might over diagnose the case, and then we might over enthusiastically treat the patient.
Yes, that water intake, the environment in your
Yes, sir,
OPD,
yes, sir.
so AC, non-AC, and patient from which community can that socio-economic condition all may, because it is a air induced, because
Yes,
it's not
yes.
a
It
direct,
doesn't
that is
detect
one
human
of the
emotions too.
biggest disadvantage, and there is a direct role on weather also.
Yes, sir.
Okay, fine.
Okay.